Hello, this is Andy Gaze. It's May 20th, 2022, and I am back with unfortunately more information that you need to be aware of. Today we're going to really focus on the risk of the new Omicron BA2 family. It's no longer fatality is the risk, it's the risk that you could get 15 to 30% chance of long COVID. So let's kind of go through the quick disclaimer that I'm not a doctor there. I'm just giving you science-based data so that you can make more informed decision for yourself and your family. So let's do the good, the bad, and the ugly. The good news is we have one of the lowest mortality rate due to vaccination, booster, and other treatments. Pfizer has just been approved for 5 to 11 years old with a new booster. There is more data showing the effectiveness of getting a fourth dose, and if you should do mix and match with the type of vaccine you had before. Unfortunately, we have some bad news. 60% of adults got Omicron, and 75% of young children between 5 to 11 years old also got Omicron in the last winter surge. Unfortunately, the new variants of BA2, the BA2.12.12 and the BA4 and 5 have a significantly higher viral load and are more infectious. So we're seeing more reinfection. So if you had Omicron, it doesn't mean you're protected against the BA2. And also, unfortunately, more breakthrough for people who are vaccinated. So the ugly is that you have a real risk of getting long COVID, 15% risk if you're boosted, and probably 30% risk if you're unvaccinated. There's unclear signs of the new wave that's happening in the US due to at-home diagnostic. We'll talk about this. And unfortunately, we can see the ultimate metrics, which is US hospitalization has gone up 35% in the last 2 weeks. We'll talk a little bit about, at the end, about the fact that the real death worldwide has been around, estimated by the World Health Organization to be 15 million, and we passed 1 million in the US. So let's look at this Omicron family. And you can really see that Omicron is really a SARS-3 is what Eric Topol, the physician, is really saying. It's a different animal. It has different mutation there. And unfortunately, it's more infectious and is avoiding the existing antibody that we developed for alpha. So worldwide, you can see in a short period of time, we have Omicron took over the world, and now is new relative to BA2 is taking over the world. So it is a shorter and shorter period of time to get these mutations going globally. So why are we concerned? Omicron is 3 times more contagious than the original Delta. And you remember we were all complaining about how bad Delta was. Its affinity to bind to the ACE2 receptors is 3 times higher. It has a higher viral load. The good news, it's really more into the upper trachea as opposed to the lungs, so we've seen less problem with people being hypoxemic. It has a faster peak to infection. Fortunately, that's during a time period there where people don't know they're infectious yet, so they spread the virus very quickly. So the other problem is BA2, which is the second generation of Omicron. It has 2 times the viral load of BA1, and this is a Swedish study that has made that analysis of the upper pharynx, which is unfortunately how we spread the viral load as we are breathing. And you can see these ladders that really show how this COVID virus has mutated in the wrong direction as far as we're concerned, which is high viral load, but unfortunately also more infectious. So that is why so many people around us are getting Omicron despite the fact that they have been vaccinated, boosted, or had prior infections. So what is the problem? Eric Topol called this really a SARS-3, is the way we should define it. And what you're going to see is that we have new mutations that are unique to this BA2.121, which is the L452Q. And then BA4, which is not a new thing coming out of South Africa, we'll talk about, has 3 more mutations we hadn't seen there. And so a lot of people think they may be protected because they had Omicron, and they are not. I really want to emphasize that. If you think you have immunity because you had Omicron 1, you may not be protected against this BA2 and BA4-5. So Dr. Topol said that it's really an acceleration of the evolution of the virus. It's spreading around the world even faster. It's unfortunately escaping the antibodies that we've been building for infections or vaccination. And so we see the reduction of the effectiveness of the vaccine. You're going to see we saw higher hospitalization and mortality for people who were vaccinated and boosted, which wasn't the case with Delta. So we are concerned about new variants coming in the coming months. So Africa has some interesting data. They did a seroprevalence study in part of Africa, and they estimate that 61% of Africa has some type of antibodies due to infections, and that puts the estimate to be around 800 million people in Africa. And you can see they had different waves. You can see the different color. Alpha is green, beta is purple, and then Delta, they really got infected, not necessarily with Omicron, at least as of this data there, which was at the end of Q3 2021, when Omicron was just starting to happen there. So we shouldn't assume that for some reason Africa escaped this. South Africa is unfortunately the incubator of every new generation. And you can see this peak, and this is really the scary part, which is pretty much 90% of people in South Africa got infected at some time with one of those, and they're getting reinfected. And you can see we have this new version, the BA4 and BA5, who are now in this orange and color there. That's unfortunately coming back and replacing the original BA2. So why are we worried? Because when we look at the titration, you can see that the BA4 and 5 basically decrease the antibody that people who had prior infection by a factor of 7x. Even people who are vaccinated still have their antibody decreased by 2 to 3x there. And so that's a concern that, that a lot of these people are going to get reinfected with these new variants, which unfortunately now is also in the US, but not in a significant amount. But just wait. 60% of Americans have been infected by COVID, Omicron, the BA1, in the last surge. And 75% of the kids less than 11 years old. And this is where we are, I think, exposing ourselves, because these people think they're protected. And what we're going to discover, unfortunately, is this BA2, and hopefully we don't get BA4, are reinfecting people who had these antibodies in the last December-January surge. So what is happening? Look at this. This is BA1, and you can see that had that big surge. Sorry about this. That had big surge in February and January there, and then we had a BA2 very quickly took over, and now we have that new one, the BA2121, which is so contagious and escaped the antibodies, who is pretty much taking over. I think probably in a month it's going to be 95 and 99% of the U.S. So why is that a concern? Since we talked, the U.S. had kind of plateaued on at around 30,000 cases, but now we have pretty much tripled to 100,000 cases in the last 2 months. But it's really estimated that it could be 5 to 10 times higher, and that's because most people are getting tested at home, and they don't necessarily report the fact they're positive. They just, stay at home and get themselves, Paxlovid by the doctors, or they get, mild symptoms and they just go through it. So we are not really aware of the true wave that we're going through. So unfortunately, we have to look at other factors. You can see that the recorded cases, which are most of them are PCR tests, have started going back up, unfortunately, there, and has been a 3x increase in the last month. Community case per capita, again, based on positive PCR tests, has started to go back up also. So positivity rate is really one of the way we can see how badly we are. And so typically the World Health Organization wants us to be below 5%. Only 3 states, including California, have a positivity rate below 5%. Now the majority of the states are way above that. And so as a result of that, you should assume that the number of real cases is significantly higher than the 100,000 that we just reported, which is a 7-day average. So hospital admission is the real metrics to look at. It has gone up 24% in the last week, and that's a 7-day average. It has gone up over 30% in the last 2 weeks. So we're starting to see that surge, unfortunately, driving people back to the hospitals. This is the thing that worries me, is that historically people who end up hospitalized or unfortunately having fatality were the unvaccinated. And now what we start to see, especially in the pink, is the boosted elderly, who unfortunately, thought they were protected and picked up this Omicron and are having, unfortunately, bad outcome there. Same thing for the vaccinated, which is in the light green. So this is what we don't want to see, is that we're going to see a rise in hospitalization and fatality just because these BA2 variants there are escaping the antibodies. So another way to look at this is to look again at that pink color, which really show you people were vaccinated with a booster who unfortunately had a mortality there. You can see it is rising month to month. So the bad news is only 31% of Americans got any booster shot. Most of them is maybe only one booster shot. And with 60th in the world in protecting our populations, in particular the elderly, are at risk. So if you haven't got at least one booster, please get it. If you haven't got the second one, we'll talk about it, when you should take the fourth dose. So unvaccinated infected people with Omicron have low immunity. Data just came out with the New England Journal of Medicine looking at 146,000 people who died from Omicron. And what they show is that there's very little what's called cross-reactivity with the earlier variants, i.e. if you have antibodies from the earlier variants, that does not mean you are protected. I really want to emphasize that. So they did a really interesting analysis of the antibody titer, and they saw that the people who had been infected only protect 79 units against the Omicron versus people vaccinated who produce close to 10 times more, 680. So again, if you're still one of the few people who are unvaccinated, you really want to consider getting vaccination, because this Omicron is really not to be ignored. So vaccinated people at the highest level of protection get all 6 variants. This is a graphic. I know it's really busy there. You can see it's a logarithmic curve on the left side as far as the scale. And you can see that people were vaccinated. This is the reaction and the antibodies they build when they got Omicron. People were unvaccinated without prior infection there has a much lower amount of antibody being produced there. And then people were unvaccinated that had been infected with another form, they had some production of antibodies, but not as significant there. So please, if you're not vaccinated yet, really consider. So let's look at some data on how much antibody you produce. And this is very interesting. This is the data for the first booster. And when you see that people who had 2 Pfizers and they took another Pfizer, they increased their antibody by a factor of 14.9x. But people did mix and match, so they took a Moderna, had a slightly higher increase of antibody. That's because the 2 vaccines are slightly different, so you may have more breadth of antibodies in a higher amount if you do mix and match. I'll let you make that decision or talk to your physicians there. Same thing with Moderna. Moderna people who basically had the 2 initial there and went to the Pfizer there, they noticed that they had more antibodies support. So why is that important? Because now a lot of people are trying to make a decision on the 4th booster. I personally did, and I did a mix and match, just so that you know. The data from Israel, which on 1.2 million adults over the age of 60, so it's a significant database, is that if you take the 4th dose, you have a 3.5 times lower severe case, but also you have a 50% low infection rate, which means you slow down the spread of the virus to your loved ones. So you really should consider that. Now, one of the problems with the 4th dose is that the effect may only be temporary, and we're talking 2 to 6 months. We're still trying to understand that. Another data that came out from healthcare work, it's another study from Israel that really show that you have that improvement after that. You can see that 5 months after dose 3, and then you have that 1 week after dose 4. You have that big boost that goes up again. It's a logarithmic curve there, so just be aware. So another study from Israeli healthcare system there on 500,000 people over the 60 is that the second booster decreased mortality by 78%. So if you're an elderly, I think you should seriously consider getting the 4th booster. If you're over the age of 50, the data from this Cumulative health system there showed a drastic reduction, 78% reduction in the severity and the mortality of the people who had the 4th shot. Another thing to consider is Eric Topol, showed this data from Science published in March that show that if you mix and match, so if you have Pfizer, you take Moderna, or vice versa there, you do have an increase in breadth of antibodies. This is the detail where they look at Pfizer and AstraZeneca, which is the CoronaVac in Chile. And again, without going into all the details, you can see that there was a slight improvement in the higher protection there if you did the mix and match. So treatment guidelines, the good news is Paxlovid now is getting more readily available. If you test positive there, that's the first level of therapy. And as a backup, if for some reason you cannot take Paxlovid, there is the Merck drug there, but it has a lot of side effects. So you really want to talk to your physician about this. The test to treat, this is a website where you can find out the pharmacies that can test and treat. I think it's not fully available yet. A lot of my friends who got it, they still have the physician that wrote the prescription after they tested positive. And so something just came up that you need to keep an eye on. There's a rebound of Paxlovid. So you get test positive, you get the PCR to confirm that. You take the Paxlovid for 5 days. You have a little bit of a metal taste in your mouth, give you the heads up. You get negative, and then it comes back positive. And one of the reasons they think it's happening is that Paxlovid was really tested on Omicron BA, and I just told you earlier that BA2 has a much higher viral load. And so it could be that there is not enough drug amounts to really fight it. So there may not be enough drug exposure there. So that's something that the FDA is following. They still have not changed the amount or the length of taking that medication. But if you take Paxlovid, please continue to test yourself, afterwards, just to make sure you don't have a rebound and you're infectious again. So the FDA has cleared the booster for 5 to 11 years old. That's only 5 months after the second shot. The big question is that it's estimated it only gives an extra 3 to 6 months protection. So a lot of people are thinking that they should probably wait to give this to their kids in the late fall before the winter surge. And so I would just let you make that decision there. For the less than 5 years old, there's ongoing trial by Pfizer and Moderna has submitted there. It's expected to be coming, but there's no specific date yet. So let's talk about the real issue here, which is the real risk of Omicron is developing long COVID. And we're going to spend some time on that because unfortunately the press is doing a terrible job at explaining this. And in my mind, fatality is not the risk of getting Omicron. It's really the chance of a 15 to 30% risk of lasting symptoms that could be for the rest of your life, or at least, for a long period of time. The data is coming very clear from multiple sources that if you are vaccinated, you decrease that risk by 50 to 60%, depending on the sources. Unfortunately, 70 to 75% that developed long COVID were asymptomatic or had mild and moderate symptoms during the acute phase of the infection. And I'm going to spend more time explaining this, but the risk and severity is clearly linked to if you got hospitalized. There's different data about men versus women, if you're in black race, or age of 75, and unfortunately obesity, which is half of America. So one of the leading cause that's perceived is what's called this virus persistence or reservoir. We now have multiple studies showing that the virus RNA, which clears in more people after 10 days, for other people may not clear and stay within the body and goes inside organs from the brain to pretty much all the organs all through the body, and has been now verified by autopsy and biopsy people who still have symptoms. And I'll show you some data about also in the poop. The other thing you need to be aware is that there was a recent Northwestern study showing that 42% of people still had positive PCR after 14 days. So don't assume that 10 days and you're over and back to normal there. Really watch yourself there, because you may still be infectious, or if you're going too quickly back to a normal life, you may unfortunately not allow your body and your immune system to clear the virus, and then you're at risk potentially of long COVID. So let's look about what is going on. It turns out that prior nasty virus in the past developed what's called this post-acute viral infection. So this is not just typical to COVID. In fact, we saw that with Ebola and the original SARS, and so they all end up having different names. And you can see that a self-reported long COVID there, is between 10 to 15%, and some of them have activity limitation, i.e. they're so exhausted they cannot go back to a normal life. So let's do a deeper dive on this. There's a very nice article in Nature that just came out, has a deep dive on all the papers being published so far, saying there really seems to be 4 causes, and we're still learning this, about what the problem is. I just mentioned to you the pathogen reservoir. So the RNA of the virus is staying in the body all the way to your brain, your heart, everywhere else, and unfortunately continuously stimulate the immune system there by releasing RNA virus. There's and also believe that people may have dormant virus that get reactivated, and you end up with an autoimmune disorder. There's also tissue damage. Some people had blood clots or some damage to their lungs. And then there is a dysbiosis reactivation there, which is this dormant virus that we're just mentioning there. So we're still investigating this. The recent data show that the poop is showing that in the intestinal system, and there's been another paper showing autopsy, that they do find an active virus in the fecal samples. And up to 4% of people who had been infected had still, those fecal samples there that were positive up to 7 months. So, I think the idea that you're 7 to 10 days and this is over may have to be readjusted there. So that means it's estimated that up to 24 million Americans may have developed long COVID. I emphasize that because we have no cure and we have no easy way to diagnose that. And so that means that 20% of unvaccinated are being estimated to have developed long COVID, and 5% are fully vaccinated. Again, we're still learning. It's very hard because we just got a new ICD-10 code, which is the way we code this in the medical records, only as of October 2021. We're kind of late in getting our act together there. A lot of the people are estimated who were in the hospitals, 50% people who are hospitalized have a risk of developing long COVID. So what are the symptoms? The biggest one is brain fog. It's like a massive concussion of the brain. You just don't think straight. I mean, you have memory problems, memory recall, ability to do multiple tasks at the same time. The other key characteristics is called chronic fatigue. So you just go up and down a flight of stairs, maybe with your laundry, and you're just wiped out for several hours. So I'm not talking running a marathon or just doing daily tasks and just can do that. We also have 10% of the case where they do cardiac myopathy. There's an inflammation of the heart. And if you have anything that looks abnormal, like in your heart or you think you're not there, you should get yourself checked, do an echocardiography, and then it can be treated. If you don't, you're at risk of getting, unfortunately, heart attacks and much bigger complication. People develop chest and joint pains. These are kind of the very high level ones that you can see. A lot of them have these symptoms for the first 90 days. Unfortunately, some people, have still 180 days. And now we know from people who were infected in 2020, it could be up to 2 years. I want to reemphasize there's no clear diagnosis and no clear treatment there. 50% of those patients after 90 days can no longer work. They're so debilitated that they cannot have a normal life. Unfortunately, it's very hard to get disability payment. Also, the Biden administration has made this into an okay category there because it's hard to make diagnosis and treatment. It is extremely difficult to get the right paperwork to get those payments. So let's just look at the systemic long COVID review. That was really excellent. I look at 200 studies on 120,000 patients there. And this is pretty scary there. You see that 57% of people had a problem after 6 months. 31% complained of fatigue. 20% of neurological symptoms, concentration, headache, cognitive impairment, dizziness. 20% had PTSD and depressions from just dealing with a lack of normal life. A lot of people had a problem breathing. This is called dyspnea. And a lot of people had exercise intolerance, 14%, and palpitation. That's the one you really need to make sure you get tested if you have anything like that. So this is very scary. A study done for people who got infected in 2020, so before the vaccines were readily available, 32% of adults over the age of 65 developed long COVID, had still long COVID at 4 months. That means that up to 2.5 million older adults may have long COVID. And unfortunately, because people are aging, they say, oh, it's just aging. So the brain fog, the exercise fatigue can be confused with just accelerated aging as opposed to be due to the infection. A study from BAG, the British Medical Journals, one of the top journals in the UK, showed that the infection rate is 18% for adults 18 to 64 years old, had problem at 4 months, and 32% at 65. Again, these were people infected in 2020 before the vaccines were readily available there, but these are like scary numbers. And they had 87,000 matched adults. That means they had the control and the people who had the long-term symptoms there. So it's a huge data set. 73% of those were not hospitalized and were just treated at home. So don't assume it's the old and the elderly who are in the hospitals. You are at risk if you get infected. And this is another scary study from Northwell that shows that 13% of people of the age of 65 develop dementia a year later. So it is clearly damaging the brain. So long COVID risk for people over the 65, this is that BMG study. You can see respiratory failure is one of the biggest problems, mostly for men. Hypertension also, amnesia, kidney injuries, all the things we have talked in the past. Of course, if you're admitted there, things are even worse. So clearly, if you're admitted to hospitals, you have the higher risk of developing these long-term problems than if you are admitted. So clearly, hospitalization is a serious risk factor. Another study just came out from the Lancet on 2,300 people who were in the hospitals there, and only 25% fully recovered at 1 year, which means 75% still had problem at 1 year if they were hospitalized there. And the risk factor they saw was female obesity, and if anybody who was on the ventilator there. And they saw a sign of interleukin-6, which is an inflammatory mediator of tissue damage. So it is clearly a wrecking ball inside your body. Mental and physical impairment, as you can see, is also a big risk for these patients who were hospitalized. This is a new one. We saw some signs of that, but not as a huge data sets from the VA in the US. It was published in the Lancet. There was a 40% increased risk of diabetes at 1 year. So it's clearly damaging the pancreas and triggering people into diabetes there. There is a study in the US done by the NIH called RECOVER. And they are built on an AI to try to predict who may be at risk, what are the risk factors. And so far what they have identified is people who have anytime long-term respiratory symptoms, so anybody who has asthma, COPD, or any type of lung complication has a higher risk of developing long COVID. People who had sleep disorder and chest pain, and anybody with pre-existing condition, diabetes, chronic kidney diseases, and chronic pulmonary diseases are all at higher risk of developing long COVID. Clearly, vaccination has decreased the risk. That came from pretty much everywhere. And you can see in this graphic there that if you had the COVID vaccine, you drastically decrease what's called the odds ratio. 1 is being the average there. So you can see in this case, it's up to 60%, over 60% lowering of the risk of developing long COVID. So again, you really want to stay up to date on your vaccination and your booster. So they did a top long COVID predictive factor there. Again, I just discussed that. You can see the data is very clear-cut that it drastically increases. The red is, of course, the one you're looking for. So mortality is no longer the right metrics there. Unfortunately, we still have a lot of people dying there, but you can see we're doing a good job at managing that. And that is because we have this better treatment and vaccine. You can see the mortality rate on the unvaccinated was extremely high. During the winter surge, it has gone down. Unfortunately, we see a little bit of an increase of vaccinated and low vaccinated there. And as a result of that, there's fewer hospitalization of COVID patients. Again, I want to emphasize that 72 to 75% of patients who don't get hospitalized are still at risk of long COVID. So the metric is not just hospitalization mortality, is really the risk that you may end up with an impaired symptoms for the rest of your life or a long period of time. Changing the subject there, the World Health Organization, who officially recorded over 5 to 6 million deaths, say that in reality it's probably 15 million people died in 2020 and 2021, with the big delta being, of course, in India and Southeast Asia and Africa, which is totally underestimated. Unfortunately, the US, we passed 1 million deaths. This is a little flag for every 1,000 people who have died. So it's hard to visualize, the magnitude of this, but it's twice the amount of people who died in World War II in the army. So the new variant is unfortunately creating a higher death toll. This was a bit of a surprise when I saw this. You can see that the Delta and the early Omicron there had a higher fatality rate per 100,000 residents than the original Alpha in 2020. COVID is the number one causes of death for 45 to 54 years old. And then, of course, for the overall population, the elderly population, is, of course, at a significantly higher risk. Black and Hispanic had higher mortality than the white population, especially for the elderly over the age of 65. And men had a higher death rate. Vaccinated are 42% of the deaths. That is something new. I mean, really, historically, it was mostly unvaccinated, but you can see with Omicron BA1 and now, unfortunately, BA2, you're going to see these numbers getting worse in the coming months. We're unfortunately at a higher risk. This is a study that the San Jose Chronicle here, which is a local newspaper, did. If we had taken the mortality and infection rate of the San Francisco Bay Area, what would have been the impact nationwide? And they calculated that we could have saved 650,000 lives out of the million. And because the Bay Area had the 10th lowest death rate, and we have a higher vaccination rate of 81%, versus 65% lower obesity rate, mostly it's behavior. And people really listen to the health authorities, and when they asked to be locked down, they did gruntly, but they did it. And they try to behave wearing masks and all of that. So I think it's kind of a sobering lesson that some of this is unfortunately self-inflicted because we had the protective tools like the mask and some of the treatment and vaccination. But unfortunately, it is what it is. And then I had to terminate it with something just for the fun of it. This monkeypox, you may have heard in the news. It's very rare, so there's no pandemic. Nobody freaks out. But since it's in the news, I want to talk about that. It's unfortunately related to the variola viruses, which called smallpox. Right now, there's a bit of an outbreak in Spain and Portugal. There's a few cases reported in the US and the UK. It's the flu-like symptoms. It creates swollen lymph nodes. You have a rash that appears in the face, and then what's typical and unique about this, you get these vesicles, you can see in the picture there, on the palms of the hands. Unfortunately, it is very easy to transmit. It's transmitted by the saliva, so the respiratory droplets like COVID was, and also the lesions from these vesicles there and the body fluids can infect clothes and linen, so people can, unfortunately, through contacts, pass it on there. No reason to freak out. Just want you to be keeping an eye on, people, the FDA and the CDC. Everybody's on top of it. But at this stage, it is extremely low risk. So I want to ask for your help to support these channels. Please spread the word. I think we really need to help people to be educated that, yes, mortality is down, but I think unfortunately this Omicron BA2 and hopefully not BA4 and 5 is putting us at a high risk of developing long COVID, and you really don't want to get that. So please post this to your network, and hopefully it's my last one, but I said that last time and that didn't work out, so I'll keep monitoring what's going on and come back if there is something significant happening. Stay healthy and get boosted if you think that's the right decision.